Hello and welcome to Jerry's Wheels YouTube channel. This video will come in two parts and we'll discuss respiratory infection in rats, specifically upper respiratory infection, how to know the signs, and more importantly, how to treat them at home safely using nebulisation methods. Respiratory infections are extremely common in rats, and early signs should never be ignored as they develop quickly and can cause severe harm and suffering to your pet. When we think of respiratory infection in rats, it's important to consider their anatomy. Rats have one of the smallest and most fragile respiratory systems, and this makes them extremely susceptible to both environmental and hereditary triggers. Hereditary implications are best understood by observing nature. Female rats will typically birth 6 to 12 litters in their lifetime, with each litter consisting of 6 to 13 pups. The result of mass reproduction over time has meant that hereditary implications were inevitable, where disease and infection could be passed on through blood, air, and direct contact. Considering the sensitivity of a rat's anatomy makes it easy to comprehend why their environment and its cleanliness and suitability can have major implications for their health. Respiratory health must be considered when deciding on cage suitability and preventing their exposure to contaminants that can cause them harm and lasting damage. A cage that is dirty or not appropriately ventilated will cause your rat unnecessary stress to the nasal canal. This can be prevented by regularly cleaning your rat's habitat with appropriate pet-approved cleaners, ensuring litter trays are regularly emptied and lined or filled with appropriate dust-free materials, and ensuring that your rat's home is in a quiet and protected area. Rats are prey animals by nature, so stress can cause them serious respiratory stress as their immune system becomes compromised. In order for us to give ourselves the best peace of mind and help our companions avoid more serious secondary infections or disease, we need to be familiar with the most common indications of respiratory infection development. Sneezing, honking, and rattling are all relevant symptoms that can indicate respiratory distress as the nasal passages become congested or irritated. You may be able to hear what is similar to a snotty or congested nose, and your rat may overgroom themselves, particularly around their nose and mouth, unlike their usual grooming routine. You may notice a less desirable coat condition, as your rat may lose their appetite and become increasingly lethargic as their body uses more energy in an attempt to fight off infection. This can also result in a mild to drastic weight loss. Another significant symptom is the presence of porphyrin around the rat's eyes, nose, and mouth that is often mistaken for blood. It is important to note that the presence of porphyrin can indicate a vast array of underlying health concerns. However, the presence of porphyrin, as well as previously mentioned indications, is usually a strong signal of respiratory distress. Not all rats will present with all symptoms, but these are the most common warnings that your rat needs urgent attention and care to ensure that they do not develop more sinister conditions that are harder to treat. Mycoplasma pulmonis is the most common bacteria to cause respiratory complications in rats. The bacteria is both highly contagious and can lead to chronic and rapidly progressive respiratory illness. It is essential that when any of the discussed symptoms are observed, you seek medical and professional advice as soon as possible. The quicker these symptoms are addressed, the more likely your rat can recover and return to good health. The vet will usually use one or a combination of anti-inflammatory prescriptions, pain medication, and antibiotics dependent on the severity of your rat's condition. There are some instances, however, where immediate veterinary care may not be possible and you may want to assist your pet sooner. As a rat owner, it can be useful to store some basic pain medications such as Metacam or a home treatment system like a nebulizer to safely administer antiseptic mist directly into the lung. Nebulization has always been a personal favourite for me in terms of caring for my rats at home. It is of no exaggeration when I say it has been a lifesaver on so many occasions, especially when owning a large family of rats. You can use nebulization not only as a treatment course but as a preventative measure to ensure and promote healthy lungs and respiratory tracts in your rats. Many rats will become irritated or stressed, especially when being administered multiple courses of antibiotics whilst completing treatment plans, and this can cause anxiety for both the pet and the pet owner. Nebulization allows us to administer both antibiotic and antiseptic directly into the lungs safely and least invasively as possible. F10 antiseptic solution is a concentrate that is diluted for use in nebulization home systems. The solution is mixed with saline or sterile water and converted into a fine mist for inhalation by exotic animals such as reptiles, rats, ferrets, guinea pigs, mice, and birds. One of the main benefits of nebulization is that we can administer medication mist into the lung instantly as opposed to waiting days for antibiotics to take action. As you might experience signs of respiratory distress, nebulization allows your pet to inhale antiseptic mist that is proven to be extremely effective against bacteria such as Mycoplasma polaris. The treatment lasts 20 to 30 minutes and can be done once or twice a day, depending on the severity of their symptoms. In part 2 of this series, I will show you step by step exactly how I nebulize my rats at home so you can do the same. I'll include links to the solution equipment I use below, and I'll upload the instructional video following part 1. Thank you for watching, and please subscribe to our channel as we aim to create an informative and inclusive community for small animal owners.